Hi, my name is Carmen Bowman. It's been my pleasure to get to work with Wyoming over the last several years, starting with Mountain Pacific, the quality improvement organization wanting to bring knowledge about culture change to the state and start a coalition. It then turned into a 3-year civil monetary penalty reinvestment project thanks to funding from the Wyoming State Survey Agency and the Denver Regional CMS office. We called the project Implementing Culture Change Throughout Wyoming, Affecting Resident-Directed Living and Team Member Retention, and we did. There were several elements to this project. One was to support the Wyoming Culture Change Coalition, which I'm happy to report is alive and well. Another was to provide monthly education. The webinars were recorded and they are posted at the coalition's webpage. I also got to work with and coach 5 nursing homes each year who committed to implementing culture change practices, and we got to produce 5 videos, documentaries really, of 5 nursing homes in Wyoming that have truly changed culture. They're listed here and at the YouTube channel, available for all to see. Westward Heights participated in the culture change coaching and realized many positive outcomes for both those who live and work there, and we want to share them with you now. Thank you.
So, since obviously we focus on our quality major, pressure ulcer, fall, again, this is our fear when we start the program and stuff. I think our fear, and why I say fear is because back before we start the culture change, we do have a lot of pressure ulcer, a lot of skin issue, and a lot of fall. So now that, we cutting back on not waking people up, not changing them, not getting to the bathroom every 2 hours, obviously to me it makes sense that our pressure ulcer and our fall gonna increase. But you know what? That's not true. It is not true, and I will always stand by that because I'm very proud of all my team and with this culture change that everyone put a full effort into this. We talk about this. Our pressure ulcer have decreased and our fall have decreased. And I think the reason why it have decreased for me and for us, what we see is that because you allow them to sleep. So when you allow them to sleep, it promotes healing. The body have time to heal. So when they also sleep, our people are more engaged during the daytime. They participate in therapy. They are, able to enjoy their meal in a dining room. We don't give a lot of supplement. Our supplement also have cut down because again, they more engaged, they more awake, they participate. So all those things help and allow our body to heal naturally. And with our fall number have also decreased. So since we start this culture change, what we noticed that in our old way, we go wake our people up every 2 hours. And again, because that's what we were taught. So now at 2 in the morning, I'm gonna go wake this individual up, because I have to change them, I have to check on them. And then 4 o'clock, I'm gonna go do the same things. And with our people who are having a hard time falling asleep, now we wake them up a couple of times. One, they cannot go back to sleep. So when they cannot go back to sleep, what are they gonna try to do? They're gonna try to get up out of bed and therefore lead to the fall. Since we allow them to sleep on their own time, naturally, our fall number have decreased tremendously.
I do have to say that the residents now might not eat all 3 meals, like breakfast, lunch, and dinner during their day, because if they slept in and ate at 11:30, they're not necessarily hungry at lunchtime. However, their intake has greatly increased. We don't do near as many supplements throughout the day with different residents, which that is also good. And our weight loss has dramatically decreased, and we have very, very little weight loss.
When we started the Good Sleep initiative in the building, we started with 1 hallway or neighborhood. It gave us just a chance to really pinpoint and see what we needed to do moving forward. The first thing we did is we put out sleep studies and bowel and bladder assessments just for night shift. And that gave us a time to really break down when they were waking up naturally and when we needed to intervene and do some either repositioning or check and change. By the end of that first month, we had one hallway that was completely on a new program or initiative to only be woken up when they were naturally waking themselves to use the bathroom, or when it was ultimately necessary for them to be check and changed. And the amount of improvement we've seen in people's sleeping, eating, everything was just astronomical within that first month, just doing it in one hallway.
Well, we really try to talk with the residents about their personal preferences and how they've done things at home. We ask them when they like to get up. Are they an early riser? Are they one of the people that likes to sleep in? Do they eat breakfast? Are they a wait until lunch kind of person? Same with going to bed and bedtime meds. Are you a person that typically goes to bed at 7 o'clock in the evening, or do you stay up and watch the news until 11 or so? And then we try to adjust our pill pastimes to that and make it more as if when they were getting their pills at home.
It helped a lot in the fact that we have made things where it's more tuned to our neighbors and what they want and how they want things. If they want to sleep in, they are not going to get woke up at 6 o'clock in the morning. If they want to sleep till 9, we give them their meds at 9 o'clock if that's what time they want to get up. Same way, those that go to bed early get their medications early. Those that go to bed late get their medications late. It makes them a lot happier, makes it easier to move around the building. You're not always stressed trying to get medications to people by a certain time. We give it to them on their own time. And it's made a big difference. I've been doing this as a medication aide for 3 years. I've been at Westward Heights for 11 and a half years, and they're a lot happier. And it's a lot easier for me for time management as well. They're not getting their pills too early or too late that make them groggy or grouchy because they're not getting, pain medication per se on time for them, what works for them.
And then with all those changes that we made, we also able to decrease amount of hours that require for the medication aid to be in our buildings. So prior to the project, to the culture change project, we schedule 16 hours a day for the medication aid. But as the time goes, the changes been made, things like that, so now we are able to schedule med aid to 11 hours instead of 16. So that's 5 hours a day, save in labor. So I mean, the overall picture of this, the residents get what they want is quality of life. That's what they want, less medication. And then our staff that work and life balance, because they get to go home sooner, they work less day, less hour, they happy. I mean, that was a win-win situation for everybody.
One of our things that we worked really hard on is our bonuses. So we used to give out bonuses for each shift if we were short-staffed or needed some extra people to come in and help. And so we would give them $10 to $15 to $20 extra an hour to come in on those times. And we have not had to do that, especially on our night shift. Our night shift was a huge part of that, to get people to come in, and that is because of the culture change. That is because we are not overworking our employees to where they just get so burnt out that they just can't do it, and that we had to pay them money, like so much money to come in. And so now we don't have to do that. We're really excited. We've seen a huge change in that. The biggest number that we spent on that per year was $68,000. And so far in 2023, actually since September of 2022, we have not given out any of those bonuses. Our next thing that we worked really hard on and that we've seen an improvement in is our retention and our revolving door. So we were able to, I have some data here, we were able to look back at quarterly, and then we were able to look back annually. So in the quarter in 2022, April, May, and June, we were retaining 69% of our employees. And that actually jumped up to 86% the third quarter of that year. So July, August, September, and we're very happy with those numbers. Then when we looked back on it annually in 2021, we've seen that we were retaining 68% of our employees. But then we looked back again at the last year since as of December 31st, 2022, and that number increased to we were retaining 75% of our employees. So we're really happy with that data, with those numbers, and it just makes a huge overall impact on the community that we have here. Another part that we've looked at, just as the administrator, I look into all sorts of different things, is our overtime, and that costs our building a lot of money. And so we are able to save in overtime hours. We were seeing 180 to 200 hours per week of overtime hours, and that was just in nursing. And so now we see an average about 120 hours. And so that has a huge impact on all of us. But really those employees that are working so hard and working all those hours, we don't want to see that burn out for our employees. So it's important that we keep that overtime, in a reasonable amount, and we are super happy with that. And it is really because of this culture change and able to see outcomes.
Yesterday was a better example than today. I woke up, but yesterday I slept probably till 9 o'clock, and I don't know whether anybody come in or I just woke up, and I get up and get myself ready, and then I come out and I go down to breakfast.
Hello, my name is Jill Holt, and I work with Mountain Pacific. We are Wyoming's Quality Improvement Network organization. Today, I'd like to share with you that of the initiatives that we work with CMS and collaborate with the Wyoming nursing homes, the 5 homes that changed culture. We have data that suggest a correlation between the initiatives that CMS has asked for us to work with, their quality initiatives of improving the lives of nursing home residents. The data suggests that those 5 homes that changed culture, that there is a correlation between those homes and the initiatives that CMS has asked us to begin to work with the nursing homes. I'd like to just identify some of those initiatives. They are adverse drug events that would require a nursing home resident to go to the hospital. Nursing home residents that have an infection that requires hospitalization. A preventable emergency room visit is also one of our initiatives. And finally, adverse drug events related to opioid use. Thank you. It's suggested by this data that they fared better living in a nursing home that had experienced culture change.
Hi, I'm Patty Hall, the Wyoming State Long-Term Care Ombudsman. And culture change is good for the nursing home and excellent for the residents, or we like to call them neighbors. It's backed by federal regulation, and it turns the institution into a home. Our 5 nursing homes that have participated in culture change have done just that. Neighbors sleep when they want, eat when they're hungry, their building looks more like a home than a hospital, and the neighbors have meaning and purpose with hobbies and paid or volunteer jobs. They are given choices, not a one-size-fits-all schedule. The neighbors have personalized care, and the nursing home saves time and money. The Ombudsman program data shows that nursing homes that have implemented culture change either don't have complaints for the Ombudsman program, or the number of complaints have gone down. Culture change is a benefit for all.
Hi, I'm Brittany Hull, representing the Wyoming Culture Change Coalition. For the last 4 years, we have brought education and awareness to our state about how doable it is to change institutional culture. we have learned that the institutional culture is an enemy we can work together to replace with culture embracing true home, and where we can introduce new systems to serve the individuals who live there, their routines and preferences. These changes in practice bring about terrific outcomes. In fact, the story of 5 Wyoming nursing homes are now documented in YouTube videos available to watch and listed in this video. We need the general public, people who live in, work in, and own nursing homes, government officials, surveyors, ombudsmen, and legislators to know that living in a nursing home can be wonderful, moving into a community where you can continue to grow and enjoy life. What if we work together to make Wyoming the best place, the best state to live in a nursing home?
Makes me feel like it was as if I was living at home. I lived on my own, so it's just about the same.
Some states incentivize with their Medicaid reimbursement. Colorado and Kansas have done this. I recommend looking at the Kansas way because they reimburse for incremental changes. Also, we want to show you the outcome data from the homes that were able to complete working directly to change institutional culture, like Westward Heights, and of those 10, guess what? Turnover did reduce. An average for all of them, 59.9% went down to 39.4%. Another outcome we typically see, they agreed to 3 practices and all implemented more, even up to 13. Satisfaction surveys improved in 5 of the 6 homes that were able to get the pre and then the post data. And we did. We implemented culture change throughout Wyoming. We affected resident-directed living, and we retained team members even in tough times. And this is very common. We have learned that all the outcomes we all want are there when we change institutional culture.